Officer for Hartford Healthcare. We'll start with some of the information regarding the patients we're caring across the system. Today we have 394 patients who are COVID positive in our 7 hospitals. Bacchus has 7 patients. Charlotte Hungerford has 26 patients. Hartford Hospital has 180 patients. Mid-State Medical Center has 33 patients. St. Vincent has 109 patients. Hospital Center, Connecticut, 35. And Wyndham has 4 patients. We also have 112 patients who are waiting for test results to come through in our acute facility. We are doing well with our ventilator management and the capacity on that sense and ICU capacity. So we seem to be in a good shape at this time. We have seen, at least in the last 24 hours, less number of patients added compared to we've had before. So it's still an increase, but the rate of increase is lower than before. Other than that, the update on the plasma therapy of convalescent plasma, as you know, this is a big step in obviously offering another type of therapy within the research bound at this time. One of our patients received the treatment yesterday, and we look forward to more donations and obviously as this therapy evolves to offer to more patients. Regarding antibody testing, I think we had made an announcement yesterday or day before yesterday that we would have capacity or capability of doing antibody testing. We do have that in Hartford Healthcare right now. And we are evaluating the best possible use of that at this time. It's going to be a research-based, as you know. Antibody testing has been heavily debated across the country, and everybody's looking into right use of that. Our team's looking into, from a research perspective, what implication it would have as we go forward in looking into our system of care. We do have, as you know, the antibody comes up after 10 days once the recovery has happened, so there are some nuances needs to be met. So the more information will be coming in following weeks as the more research becomes available, not just the Hartford Healthcare, but across the nation, and we'll keep you updated. Yesterday we talked about Colleague Support Center. I think it's a huge step for Hartford Healthcare to commit to our colleagues to provide support they need. It's a challenging time for all of us during this crisis. The service began at St. Vincent on Wednesday, and it'll be rolled out across the system by Monday, April 20th. It'll provide emotional and spiritual support to help for the colleagues to cope with the stress of providing care during the surge. It would be staffed by our colleagues, nurses, APR, and clinicians and co-workers from across the system. They'll be supported by a team of behavioral health experts, spiritual care team, palliative medicine professionals, and human resource professionals. We hope we will provide more advice about the child care services, the lodging for our colleagues across the system. And this is our commitment to make sure that we continue to support our healthcare workers across the system, our healthcare colleagues across the system. So that is the update I have for today. I'm happy to open for any questions or comments or anything else you'd like to know at this time.
Hey, Dr. Kumar, this is Emily from The Current. I was wondering what you might be able to tell us about the patient who received convalescent plasma. I know that you can't go into too much detail about that patient, but can you tell us if they are an ICU patient or what kind of condition they're in before the transfusion?
Yeah, this plasma therapy obviously is reserved for individuals who are critically ill. So this individual is in ICU at Hartford Hospital, and that's where we are right now, and received a successful treatment yesterday. Obviously, the time will tell the recovery process on that. And I'll make sure I'll update everybody as things evolve.
Thank you.
Dr. Kumar, Bridget from the Republican American. What exactly and what is the time frame in that convalescent plasma situation that you are looking for? Is it change in vital signs, consciousness? What will change first?
So a variety of factors, actually, as you know, and we've talked about that COVID-19 or the coronavirus creates a situation for the lung when there's a fluid gets collected, the lungs become somewhat stiff and has some what we call as the ARDS type situation. The reversal of that or the improvement on that is one of the biggest marker, is that the individuals are able to oxygenate themselves without the support of ventilator and other things. That is one of the most important marker of the therapy's response. We look into all the vital signs. Obviously, there's things are interconnected in several ways, but the oxygenation requirement, when it goes down, that's a sign of success, and that's where we look for.
Thank you.
Hi, Dr. Kumar. This is Sierra with the Herald.
Hi, Sierra.
Can we just go back to the numbers? I have a few questions.
Sure.
Would you be able to give me the fatalities in the system and at Hospital of Central Connecticut?
I don't actually have that number in front of me right now. Let me talk about the recovery. That is a lot more important. We have 76% of the patients actually who come to the healthcare organization have recovered and done very well. And I think we do have fatalities, obviously, across the system as well. But its rate is consistent, a little lower than other parts of the nation we have seen at this time. It depends on a variety of factors, the underlying disease. And many of the individuals have chosen to be at the place where they do not want to be resuscitated as well. So our numbers, obviously, this is a deadly disease. We're seeing a lot of toll across the nation and the country, obviously. But I don't have a specific number for the Mid-State Medical Center.
Okay.
Well, if there are no further questions, Tina, is there anything on the Facebook?
This is
sorry.
Kate from the Connecticut Examiner.
Hi, Kate.
Hi. I have a question about the PPE, the amount that the hospital has been paying for PPE equipment and products. I'm writing an article about price gouging, so I would like to know what you've been seeing in terms of pricing for PPE.
Definitely the prices have gone up, and we're paying up to 5 times the price of normally we would pay for those materials. So it's a significant stressor for any healthcare institution, especially for Hartford Healthcare, with the large volume buyers we are. And that's a concern for us. Obviously, it's a significant amount of price, and some of that is a supply and demand equation. I understand the market, how they work, but this is a concern for us right now. That up to 5 times the significant amount of impact, especially during this economic crisis all of us are going through. And I think exemplifies some of the work we need to do as we go forward as a society to make sure we have a local manufacturing, local control on those processes. And I think I like to believe our government is thinking and working on that at this time.
Thank you.
Dr. Kumar, one other question about the patient who received a plasma transfusion. How long do you think it would take before you could start to see positive effects, if there are going to be positive effects for that patient?
That's a really good question. I don't know the answer at this time. I think because these therapies are still considered as a part of research, we're still studying and still learning about that, especially in the COVID-19 cases. Now, these therapies, as you know, are not unique to any treatment, viral treatment, but we don't know how the COVID-19 will react to that at this time. So it's difficult to comment. We obviously, in ICU, we monitored the vitals 24 hours real time. And my prediction would be in 2 to 3 days' time, we should see some changes. So it's a little too early right now to comment on that piece.
Thank you.
Very good.
Dr. Kumar,
Yep.
sorry, I had one more question.
Yep.
Bridget from the Republican. There is a new drug therapy that has been announced, and it's out of Chicago, I think. I can't remember the name of the drug, starts with an R, and it does show promise. Is this something you're aware of?
I think you're talking about remdesivir. That is
Yes.
one of the drugs which is manufactured by the Gilead.
Yes.
And it has shown some promise in studies and other data we have received at that time. And it's one of the probably most promising drug I've read recently, which has an impact at this time. But there are other drugs as well, as the tocilizumab, and which is also we're using in Hartford Healthcare. So Remdesivir is again is a part of the research protocol given by Gilead, and individual institution needs to enroll into that, and the distribution has been, as I understand, based on the hotspots criteria. So not all healthcare institution has an access to that drug at this time.
Will you be looking for that drug to use it when it is available?
Yes, we are. We're looking forward to it. Very good. Well, I think if there's no further question, I'd like to thank all of you. I hope everybody has a restful weekend, and thank our colleagues, and do advise to visit our Corona virus website and Heart for Healthcare, and there's a lot of information we keep updating in real time, and thank you.